Hello, welcome back to another episode of Gab and Grow. I am Allegra, pediatric speech language pathologist, and we have
Amanda, pediatric occupational therapist, the one and the only. Sometimes I introduce you with like a grand intro. Where's
yeah,
my
I don't like that. It makes me uncomfortable
hi? You're the
because
star.
then I have to think of something on the spot, and I'm always like,
We
so
could do like cartwheels coming in, backflips.
yeah, that's a good idea.
Yeah. So we do this all the time. So it's funny, we record these back to back, hence the same outfits in all these videos. But we are always like, okay, we have to do this again. What's our intro going to be? And I have a little bit of a sore throat. Shout out my husband for getting me a little sick. And Allegra is going to teach me how to phonate through a straw so that it can
Okay,
help
this
my
is
sore
the
throat.
only voice exercise I know because I'm not a voice therapist, but this is like the only one that stuck with me from grad school. So
Okay.
you want like a cup of water that's like halfway full. Okay, that's pretty good. And you're going to literally just like almost like hum into the straw. You just want to phonate and just do it.
Are bubbles supposed to come out?
Yeah. This is more for like if you lose your voice. You have to like turn your like phonate. Yeah.
Boom.
Make noise. You're not just blowing through the straw making bubbles. I don't hear your voice.
I'm trying. This is
Hum.
hard. No, no, I'm not getting any air out. I'm so confused. I may have some praxis challenges. I'm
Does it
all
feel
better.
better?
You
Does it
fixed
feel
me.
does it feel better? No. It's more for if you like lose your voice, like sore throat.
I mean,
You're just sick.
I don't know if I'm like in my head, but it actually feels a little better. I don't
It
know if
it
I.
works like immediately and then
Hello. Check one, two. Yeah, I actually think that worked a little bit, and I'm
it
kind of
does.
in
I'm telling
disbelief.
you. It works. It
Wait,
just
that's
doesn't
so
it
weird.
doesn't last for
That's
that
so
long.
weird. I
Like if you ever lose your voice, do that and then it'll come back and then as you talk you lose it again. I don't ask me why it works, but it does.
I was just about to roast you, be like, thanks. That
Yeah.
was ridiculous, but it actually. Mhm.
I went to grad school for this.
That's so weird. Anyway, I do have my tea. So if you see me sipping tea, that will also be why.
I just put some of my pregnancy tea in the fridge. I should have grabbed that for the episode.
Wait, what is pregnancy tea?
It's supposed to induce labor.
You are evicted,
It's
buddy.
raspberry leaf tea.
Okay, so eviction notice incoming, big
Yeah.
time. When is the final eviction notice day? No mas.
Monday.
Shut up. The 14th?
Yeah.
That's so sick.
Today's my due date.
It is the due date. Oh my
It
gosh, we're recording
is.
this on your due date. Oh my gosh, hi
Mm-hmm.
baby. Hi. Come on out.
Quincy just joined us. Hi, Quince.
Hello, Quincy.
He said, I
Quincy
heard
Min.
there's a baby coming, and I've been hearing that for months. Where's this baby?
I also love your Quincy voice. It's always um for everyone
Very
listening, Allegra was
distinguished.
making is very distinguished, was making lists of what she had to do to prepare for the baby. She had a list for herself, she had a list for her husband, and then her dog Quincy, the list was to be a big strong man. And she made no,
Checked it
be
off.
big,
He
be
checked it
strong.
off yesterday, and we threw the
Did he
list out.
finally check it off?
Yeah.
It took him a while.
He got a bath. He brushed his teeth. He's all ready for the baby.
Oh, good boy. Good boy, be
Yeah.
ready. He's gonna
Mm-hmm.
be such a good big brother.
Yeah. What are we gabbing about today?
Okay,
Talking
speaking of
about tooth
your
brushing.
brushing your teeth. Actually, this is a great segue. We are going to be talking about tactile input
Nice.
and how does that tie into sensory integration, sensory processing. We're kind of continuing on with our sensory series of we've done proprioception, vestibular, and now we're going to talk about tactile. And those are kind of like the three power senses. Like those are probably some of the
But
more.
there's more than three.
There's certainly more than three. How
Was
many
there
are there?
7? Is it 7?
8.
Okay. Someday.
That's okay. We'll
Don't
get
ask
there.
me to name them.
Now I'm like,
We already did that.
we did those. But if you haven't listened, go back. We did sort of an all-encompassing episode on just a brief overview because this is going to go a little bit more in depth from an individual standpoint to each sensory system because I flew through those in that episode. So this is your
If
signal.
you
Pause,
have
go back.
things to add in on this one, I'm excited.
That'd be great, actually, because there's definitely some parts of this that involve your oral, perioral
Yeah,
area.
I was gonna say feeding.
So
I have
overall, your
feeding
tech
tactile.
exactly. Yes. Yeah. So overall, your tactile system is your information of touch, right? It's how are we getting and experiencing the world through essentially touching, feeling, experiencing. But another thing that it's really important for is your body schema. So it kind of gives you information of like, how big am I? How wide am I? Like, where does my body, my skin end, and the rest of the world begin, right? So like how am I able to interpret like my individual self in a spatial environment? And that differs from some of the other senses in terms of like I'm not perceiving the space, I'm not perceiving my body position, I'm perceiving myself. Does that make sense?
Yeah. Okay. I see it.
So it's pretty subtle differences, but the way we're going to think about it and kind of break it down a little bit more is your tactile system. When we're kind of screening for these in an evaluation, we want to get an understanding of your tactile modulation, and that is your ability to screen out and take in relevant and irrelevant tactile information. So we'll kind of get into that. What that really means is like, are you able to essentially have an appropriate response from your body to what your tactile system is receiving? So, like, if I put on a shirt in the morning, I can now say, shirt is on. That information, I experience that. I think I used this example already, but it's a good one. The shirt is on. That's irrelevant information for me now. Now I can continue on with my day. For kids who have tactile modulation challenges, that sensation is going to be experienced differently. Part of it is that they're not habituating to the input, meaning that they're going to continuously receive signals from their body of shirt, shirt,
Shirt
shirt,
on,
shirt,
shirt on,
shirt
shirt
on,
on.
shirt on. And that could be really distressing. And then the
And
other piece
overstimulating.
and overstimulating, and that's going to obviously make other cognitive tasks, other attention demands, other motor demands to be more difficult because that's where they're focused so much on holding it together and self-regulating their nervous system and just screening out all of these extra inputs from their environment and from their body. So that's one example. Another thing that so we'll kind of go through like dressing things. How are buttons? How are tags? How are shirts? How are layers? Do you notice behavioral differences in terms of dressing when it's season changes? Like when I have to wear now shorts versus, or go from wearing shorts to go to wearing pants, or go for wearing multi-layered jackets. Like all of those different sensations can create different, I guess, distress when it comes to experiencing tactile input throughout their ADLs or activities of daily living. We're also going to think about grooming, right? Like thinking about toothbrushing, washing face, washing hair. The experience of wet hair can be really distressing. And so when we're thinking about this too, we're thinking about what is the presence of touch in terms of, is it light touch or is it, that habituation? Light touch can be overall, it is our body's way of experiencing. Like think about if you have a spider crawling on you, right? And you experience like almost like a
Yeah, like the
surprise tickle. Like think about that and experiencing that all day long. Like it's that light touch can be extremely distressing.
I feel like itchy.
Itchy, yeah, that can be a way that kids will describe it
Yeah.
because they don't always have the words to say, like, this is uncomfortable, this is distressing to my nervous system. So, itchy is a word that we will hear a lot for some of these kids. Yeah, so we're thinking about all of those grooming activities. Toileting can be really difficult for kids who really are avoiding a messy play, like, are extremely distressed by, I keep using the word distressed, but affected by maybe when you're feeding, if you get any type of food on your hands or any type of other non-preferred, you're not a kid that wants to go out and play in the dirt kind of thing.
Why would toileting like
Wiping a bowel
distressing?
movement can be
Okay.
really distressing.
Okay. And that's funny because I was thinking of in terms of feeding too, a lot of times I'll offer to parents like really try to refrain from wiping their mouth or their hands until after the meal is done and like separate from the meal time
Mhm.
because for a lot of kids like that part is distressing having
Yeah.
their whole mouth like aggressively. wiped.
Yeah. Well, I think about it. So the kid with tactile modulation challenges wouldn't even tolerate them, like they would want it gone. They would, maybe you're thinking about it of like, the wiping is the distressing part, which sometimes it is. That's the part that's uncomfortable. But for some kids, it's even
Yeah.
if a tiny piece gets on their fingers or their hands. And we talked about this before, your mouth and your hands are and the bottoms of your feet extremely, extremely sensitive parts of your body. So some of these kids too won't tolerate socks or shoes
And
or walking on grass, texture
it's
changes.
funny because like I'm thinking of it too from like when I have like a kid that's just started solid foods.
Mm-hmm.
So like that 6 month age range. That's what I'm telling parents of saying like don't wipe their mouth, don't wipe their hands, like let them like engage in that messy play.
Yeah. Yeah, we want them to.
Because from my point of view, the more comfortable they are at this age, we can see decreased, and I would like to get your opinion on this. We could see decreased I don't know if preferences would be the right word, but like in
Sensitivities.
sensitivities
Yeah.
later in like toddler years. I think like maybe, but we could also see
I
the
think at
opposite.
that age, it's a perfect time to explore. Like that is so 6 months to, I mean, for a long time after that, but
Yeah,
six
like
months is when
starting
that
the
sensory
solid food.
motor. Yeah, but I'm thinking more of like a developmental exploration phase. Like they're in a
Totally.
sensory motor exploration phase. They're wanting to explore their world. They're starting to get more autonomy to explore their world a little bit, maybe as they start to crawl, sit up, things like that. Absolutely. I think that would be ideal. The thing that a lot of autistic advocates, and so, we haven't really done too much on term. And by the way, happy Autism
Oh
Acceptance
yes.
Month of April.
And
Shout out.
and OT month.
And OT month. Shout out me. So we, a lot of autistic advocates are saying we are not
Trying to
trying
push
to
those limits.
push those limits.
Yeah.
Exactly. It's what is accepting for their nervous system. Obviously, there are safety limitations to that in terms of, wearing shoes and being able to essentially get dressed. Like those are things that are
But
have to be
find
done.
but
But
finding something that's going to make them feel safe and
exactly.
yeah.
Yeah, so finding accommodations where accommodations can be met.
Hmm.
So that we are not pushing this agenda of you have to be neurotypical and experience tactile input the way that I experience it. It's more of let's make sure that your body has an opportunity to feel safe in the things that we need to do to keep you safe. So that's sort of that distinction there. But there's also the kids that love messy play, and then those are the kids that are seeking out dirt, seeking out shaving cream, like they really want that input. And, there's a lot of reasons why that can be, but one of those sort of things that come into play is something separate than modulation, which is your tactile discrimination. And that is where you're going to understand the qualities of an input. I love this example, but it's sort of where if you're reaching into your purse and you are feeling around in your purse, you can differentiate a quarter and a nickel just by feeling with your hands. You don't need visual feedback. And that's your ability to connect the tactile feedback to the qualities and how you're experiencing that. So that can also be pain, temperature, textures, all that good stuff, like even closing your eyes and feeling two different textures. You'd be able to differentiate bumpy versus like spiky, So that's sort of where that comes into play. And that's where I would think a lot of feeding challenges can come into play, like in your mouth, thinking about that as a tactile system, being able to differentiate different qualities of foods as they're in your mouth, just using your tactile receptors.
Yeah, and I always explain this to parents too of um our tactile receptors in our mouth are the most similar to the ones on our fingertips.
Mm-hmm.
So really trying to engage a child that is a picky eater um by allowing them to explore their food without the expectation of eating it. We either do it through play and again, keeping in mind especially the autistic population of like if they don't want to explore it with their fingers, like okay, what are some other options? We can poke it with a fork. putting a napkin on top of it and squishing it and see kind of just seeing where their safety levels and comfort levels are in engaging and experiencing the different textures when it comes to food, because we can't expect somebody to just open their mouth and put a brand new food in without them knowing what it's going, like what kind of sensory feedback are they going to get when they like put it in their mouth or take a bite of it. Is it going to be crunchy? Is it going to be soft and liquidy? Are they going to bite into it and then suddenly it's like a burst of juice that they weren't expecting? So being able to explore that in a safe way by just manipulating it with their fingers, and they can squeeze it between their fingers and say, oh, like there's juice that's coming out of it, so I can expect that when I put it in my mouth and take a bite.
Yeah. And so to me, you just described a kid with tactile discrimination challenges. They're not getting that information from their tactile system. They're getting it from their visual system. They're getting it from watching it and observing it, and maybe their proprioceptive system. They're getting it from other senses because maybe their tactile discrimination system isn't the most reliable. So now we need to do all this for this work beforehand to get a clear understanding of what's going to happen so that they can feel safer, like you said, to put it
And
in
how
their.
do you address that in therapy?
Yeah, I think it's different. We've talked about this in the past. It's different for different approaches. Sensory integration, you are going to work on that nervous system. You are going to try to essentially feed their tactile system more information. And I think regardless, that is going to be the route for almost both lenses of modulation and discrimination. So giving opportunities to get that body schema, dousing their whole body in shaving cream, like letting them get messy, so those kids that are maybe seeking out that messy play in the dirt, they want to know if there's mud on my shoulder, I know where my shoulders are now. Sometimes we'll do things like tracing them on a large mat or a mirror and being like, look, how can you fit in that? Like, and then seeing how big am I, how small am I, doing a lot of work in front of a mirror, again, to kind of create more of an awareness of where does my body begin and where does the rest of the world begin. Deep pressure, we should talk a little bit about this, is a big one. So deep touch pressure is essentially firm pressure, the opposite of light touch, that gives your nervous system a ton of feedback as to where you are in space. And that heavy work kind of coincides too. There is a little bit of overlap in terms of like prop and tactile when you're doing some of these treatment approaches. Prop as in proprioceptive, like crashing, jumping, squishing, massage, vibration, pulling, pushing. All of that is going to give more input and give you more grounding feedback. And so what that can do is you can use that as a tool to pair with really uncomfortable inputs. So if dressing is really, really difficult, and we know that that is an ADL that is challenging and difficult to tolerate, let's have a pillow fight before and then do squishes right after. So we are priming our nervous system to be ready for this uncomfortable sensation that's coming. And then we are pairing it with something that feels good right after as well. So we want to make sure that we're giving as much opportunity to get that from a discrimination standpoint, get information as to what is where is my body, and then modulation, what is input that feels comfortable and safe.
Like returning back to
Mm-hmm.
prefer
Mm-hmm.
a
Yeah.
sense standpoint.
Yeah, from the tactile discrimination sense too, we do a lot of work with eyes closed. So maybe you're doing a treasure hunt for beads in Play-Doh, but you're doing it with your eyes closed. So you're only relying on your touch sensation. Or you have to reach inside of a bag and try to find the right shape to match a shape in front of you. You have to crawl with your eyes closed and feel for a stuffed animal in a safe environment that you can't crash into stuff. Maybe, for kids, so from the functional perspective of like, okay, what does this impact? If you have decreased discrimination or decreased understanding of qualities of input, it's going to be more difficult to maybe have refined motor skills in your fingers. It's going to be more difficult in feeding opportunities, like you said. Maybe grasp patterns are inhibited or more challenging. And then that can affect things like buttoning or things like using a writing utensil, feeding utensils. And so sometimes it is just fine motor, or is it I'm using my whole hand and squeezing as tight as I can on this fork or this spoon or this writing utensil because I need to get more feedback towards my hand to understand what's happening from a tactile perspective. So you can use like vibration pens. You can, again, prime the hand, like doing sensory integrated activities for writing. So writing in shaving cream, writing in sand, writing in other things, because that's going to give you more information too. There's lots of different ways that you can approach it, but it is sort of taking one step back and saying, okay, I'm seeing these differences in maybe using your whole hand to pick up something small. Is it coordination, or is it I am squeezing really hard and I have trouble with force discrimination and separating fingers from my whole hand because of tactile discrimination challenges. So it's kind of a fine line, and that's where an OT would come into play to help you differentiate with your specific child.
What's the age that you would expect that to kind of be integrated?
What specifically?
Like using whole hand to like that rake.
Yeah, so around 6 to 9 months is when
Okay.
kids start
So,
early, is when you'll start to see kids developing an inferior, kids as in babies, inferior pincer, meaning like their thumb is kind of touching right under their pointer finger's middle knuckle, and then towards more of a refined pinch like this. But yeah, pretty early on, kids are starting to separate that sides of their hand. Sometimes, a way to differentiate that, and we'll do this in evaluations, is touching each finger to your thumb. That can be more of a coordination challenge, but if I ask you to do that with your eyes closed, and I see a big difference in you being able to touch your thumb to each individual finger, that's going to tell me a little bit about your tactile and
they're
your proprioceptive
they're
system.
relying more on their visual system to help them
Correct.
scale.
Exactly. Exactly. So I think that's one way to think about it. There's definitely specialized testing that can be done from if you're certified in the SIPT, which is a sensory test, or the EASY, which is another sensory test, but those are certified sensory integration tests that you would need to see a specialist to do. And then that would be kind of if you're, and a lot of times it depends on your approach. Are you taking a top-down approach of this kid maybe just needs to learn strategies from an organizational standpoint? We can say, like, let's practice this from a motor learning standpoint, or do we need to take a bottom-up approach of let's flood your nervous system with more input so that you can start to differentiate this over time?
Um, why would somebody need to see, like, I guess what's kind of like, can you go to any pediatric occupational therapist that will have, like, will they have knowledge in this, or is it more specialized? Because you just said that you'll have to find somebody that's trained in those specific assessments for like that
Yeah.
type of therapy. Is it sensory integration? Is that what it
I
is?
was going to say,
That's
so
more
I would say sensory integrative therapists do require specialized training. So if
okay.
your therapist is saying they're doing sensory integration, then they should have specialized training. If they haven't I would say most OTs at this point have a basic understanding of sensory processing. I think it really depends on the approach. If the therapist is saying, we're learning sensory regulation strategies, any OT can work on those things. But if they're saying sensory integration, that subtle difference in
Okay.
what you're doing requires
Sensory processing disorders, that would be that's not requiring that sensory integration
Correct. It depends on
training.
the kid. Exactly. It really depends on the kid. And it depends on the training of the therapist. But I wouldn't say every kid with sensory tactile differences or sensory processing challenges needs to see an SI therapist. That's not true. It just depends. So,
Hmm.
yeah, I want to talk a little bit about input that can be alerting and then input that can be calming, right? So we use tactile input often to help our nervous system either feel more awake or more calm. So, like when you're selecting at home things that you might think would be calming or alerting, being aware of how they might impact your child's nervous system. For example, like something sour would be really alerting. Something cold would be really alerting. Light touch is really alerting. So light touch and pain actually travel along the same pathways in our body to our brain. So thinking about that, like tickling, like that can be really alerting and sometimes really uncomfortable. So, like watching your kid for signs of they're laughing, but maybe they're not actually
Enjoying it.
enjoying tickling. So, making sure you're taking frequent check-ins on that. So, then calming, we're thinking more firm, deep pressure. So, in deep pressure, we're thinking about our hand kind of staying in contact with our body. We want to try to minimize touch away and touch back and touch away and touch back for kids with sensory modulation challenges, because that pause in moving away and then the input coming back on can be very overwhelming as well.
Like the continuous
Correct. Yeah.
touch or pressure.
Um, I will mention briefly, there's a protocol. It's called the Will Barger brushing protocol.
I've heard of this.
I will, I mean,
Is
there's
this the
mixed,
only brushing protocol though? Maybe it's
yeah,
not this. Okay.
to my understanding, there may be another one. Maybe I don't know about it, but essentially this is a protocol that you can use it was initially sort of created to help kids with these modulation challenges. We now know there's mixed research on it, but it is effective if the child responds to it, in terms of if a kid enjoys getting this feedback, it's going to bring more attention to their body. So maybe using this almost as a way to prime an activity, or before feeding, maybe you're doing vibration on the mouth. It's the same sort of concept of how can we get the nervous system, get your tactile system to be more alert, awake, and aware before we have to do something, maybe a little bit of a higher demand. So same idea of you're doing putty or Play-Doh before you do handwriting, or you're doing shaving cream before we do coloring or buttoning or whatever it might be. You want to get more information.
Pairing it with like I don't know, I guess preferred and non-preferred. I don't know if that would be like the right
Um,
terminology.
I mean, you can think of it that way a little bit, maybe with
Comfortable,
a modulation
uncomfortable.
of like, I have to brush my teeth. How can we build this into the routines to have your body be safer? And we're thinking of ways to adapt this the best we can. If you like a vibrating toothbrush, let's use a vibrating toothbrush. If you like the softer bristles, let's use the softer bristles, right? So we're
Yeah.
using that, like we're meeting them in the middle as much as we can. But at the same time, it's one of those things where oral hygiene is important. We have to brush our teeth. What can we do right after to help our body feel safe again, or during and before? So it's kind of building that into the routine and structured as best as you can.
Yeah. I like that. Giving, and we talk about this a lot in speech therapy too, but like you as a parent have the ultimate quote unquote say or decision making. Give it finding ways in your day to day to allow the child to make choices about how that end goal is going to be met, so that they feel safe and in
Yeah.
control of their
Yeah.
bodies and their situation too.
Yeah. Yeah. I also like giving previews as much as possible of, even if this child is 1 years old, hey, we're gonna wipe your face. And then they get a heads up, that something's
I
coming
do that
in.
with Quincy.
You took Quincy.
I tell Quincy what his plan is for the day and what we're about
Big
to
and
do.
strong is number
No,
one.
but I think that from a receptive language point of view, for even babies, like that, you're just bombarding them with as much language as possible, and that's not going to hurt their
Yeah.
communication and language system. And you're allowing them to, even if people are like, oh, well, they don't understand you, maybe not right now, but the more you talk about it and pair it with actions and objects, and that's how we learn.
Yeah. So previewing can be really helpful. A lot of times kids with modulation challenges sometimes have trouble with that localization of input. So like if I was to touch your back, having a difficult idea pinpointing exactly where I'm touching on a bigger surface area like your back. So that way it's kind of like, where did that come from? And so kids are genuinely experiencing, and adults, whoever might be experiencing tactile modulation challenges, or sensitivities, they're experiencing a threat it feels like a threat to their body, and there's no way for their nervous system to differentiate a true threat and attack. And so that can feel really, really difficult. So we sometimes compression garments can be useful for specific kids, like tighter clothes. Some kids really like looser clothes, so it really depends.
This
What?
is completely unrelated. Have you seen the TikTok trend of like point of view, my nervous system doesn't know the difference between like
Oh,
X and Y, and like it's like something really
it's like being chased by a bear and sending an email to my boss.
yes, that was a good
Yes.
one.
Yes, yeah. Yes, I have seen that.
That just made me think of it.
But it's true. I mean, like, there's a version of fight or flight. Our protective mechanisms come in and our body's saying, like, something's not right. And that's our body's way of protecting us from things that are perceived as a threat. But in this instance, it's things that are beyond the individual's control. So weighted items are very useful. Sometimes weighted vests can be useful. We've talked about but we've talked about this in terms of growing and things like that and habituating to it. Weighted blankets. Oral activities are great. So chewing chewies are really fantastic. Heavy work, sucking out of a straw is really fantastic. Heavy work, and all that can be regulating, but it all just depends on what your kid wants and needs.
Very individualized.
Very individualized.
I think it's time for you to give me
Yay! Okay.
a household item.
You know what? You got me in the last episode, so you have to make this
Yeah, I'll try.
a tactile discrimination activity. I'll make it easy on you. Bowl of rice.
Okay. Uncooked?
Yes.
Okay, we're gonna hide some like small little toys. So I don't know. Kids probably don't play with Polly Pockets anymore. Those
They could.
those size little toys, and we're gonna either close our eyes or have like a blindfold on, and maybe we'll do like a couple of different, like very different shaped toys hidden in the rice, and see who can find the square shape first, without looking, and who can find
Ooh.
the doll first, who can find the hat. I don't know, whatever
I love this.
items you put in.
You know what I could see my kids doing now?
Yeah. I feel like you don't get a bowl. You get like a tub and you do it
Yeah.
outside.
Yes. I mean, I've had kids fully get like a big tub,
Yeah. And go outside if it's nice.
go in it, and go in it.
I've
Like,
I've seen like putting like garbage, like cutting a garbage bag up and just like throwing it on the ground and then putting a tub of rice on that garbage bag.
sounds fun. Sign me
I
up.
feel like the tactile things too can go to be passed down by the parents.
Yeah.
Like if
Wait, what do
you
you
have
mean?
like if you have a parent that like really hates messes, and
Not always. Sometimes it's like a very
I see that a
interesting
lot with
pair.
feeding.
That's interesting. Yeah, of like I'm cleaning up constantly, so that makes a lot of sense. I
Yeah.
could see that. I could see that. Well, what an awesome time I had gabbing with you, Miss Allegra.
Hopefully next time I'll have a baby.
Oh my God, you definitely will next time. That's
I
so
better.
exciting. This is our last childless episode.
Yeah. Well, thanks for gabbing with us. Make sure you like, rate, subscribe, follow, comment, just listen, share. Anything
Talking to you,
else?
Casey.
Thank you.
Thank you.